Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
One of the first men to actually have a class. Been women up to this point. And so that's why they made a point of it. And the question is, what are the underlying conditions that make one person more likely to get it than the other? We talked about women, but we haven't, this is the first man, so it's going to take a while for us to figure that out as well.
I was wondering if the underlying conditions, people may have been able to develop those clots anyway, you know what I mean?
Well, we don't know enough about it yet. So I suspect there are some underlying conditions that we'll learn about, but we're not knowledgeable of right now. But it has to be something that is in common with those 15 women and the one man. But we haven't figured it out yet. So. And this is why the CDC is probing and across the world trying to figure it out, but they haven't come up to why these clots are forming. This has been something that, as Buchanan had mentioned, is an issue relative to the perhaps the adenovirus that is the vector that's used in comparison with contradistinction to the Moderna and the others, which are not associated with the virus. But we haven't figured out the whys and the wherefores. And until then, they just put a notice on the medication, if you use it, that this is a complication that is known to occur. Now, this is something new that a number of universities, including I think some local universities, are requiring the vaccine for all of their students. I don't know about Notre Dame. Have they said anything yet, John?
I'm not sure. I haven't.
Yeah, but anyway, there's a number of universities that have already announced. Stanford had mentioned it, and some others have mentioned that they're going to require vaccinations for all their students.
CJ is supposed to be going to Townsend this year, and it is a requirement. Of course, that's not something that his parents want, but I'm glad it is. But I'm glad it's a requirement. So I guess he'll be getting a vaccine. Yeah.
His parents are opposed to vaccinations?
Yes.
Well, we know Chris is, but
yeah.
His mother is too. Okay.
Yeah. Mm-hmm.
Then he has a school that won't employ vaccinated teachers. Stay away from
South Florida. Trump.
I tell you, every place has its own unique situation. And here they think that the vaccinated people will spread the virus. So, oh well, yeah. And they didn't publicize their stance, so I guess, yeah. All right, let's go to the next one. It's interesting how people have different ideas. And this is an article that brings up the point that we've discussed many times, that we need as many people as possible to be vaccinated so we have herd immunity, so that we can eliminate the need for all of this isolation and masks and so forth. And until we get to the point of 70% population being vaccinated, that's not going to be the case. So And as you can see, only 36% of the population has been vaccinated. So we got a long way to go. Although the data may be incorrect because it may not require as much as 70%, but at least we should shoot for that at any rate. There's also articles about some people who have not taken their second dose, which is another issue of great concern. People get the first dose and not get the second dose. But people are people, and as was discussed, when you're in a democracy, they have the right to refuse. This is an article that was front page of the Washington Post, talking about loosening the mask guidelines, and I think Buchanan has a blast that it's going to show later that addresses when and when not you need to wear your mask. And this goes into the outdoor safety and the indoor unsafety, and when you should wear a mask, when you shouldn't wear a mask. It seems like when you're around vaccinated people, and the question is, how do you know they're vaccinated? It's pretty safe to be unmasked, but if you're outdoors, it's safe to be unmasked. But indoors, it's safer to be masked. And this is a good graphic and it's good for you to print it out and look at it, so you can identify those circumstances that look. You can see this full capacity worship service. You still should be wearing masks. Indoor movie theater, masked. Singing, masked. Did it address your concern, Buchanan, in terms of playing?
Absolutely. Yes, sir.
And what did you decide to do?
I'm going to attend and have a mask on.
Oh, okay. How do you play with a mask on?
They have a special one. They have a special one that covers your nose, but it has a slit, so I can put my mouthpiece up through the slit.
That's interesting. That's nice to know. Yeah.
I actually had the graphic backwards. This is the one that people are happy about right here.
Oh yeah, I guess so. Yeah. Although, yeah, that's the easy part. Yeah.
I did that yesterday for the first time in over a year when I walked, and I did not wear my mask. I had it in my pocket in case of a closed-in situation, but I was able to walk 3 miles without my mask. It felt really good, and my glasses did not fog up.
Yeah, well, I think this is a nice graphic that answers the question. I thought it was a very good idea for them to do that, and so remove some of the issues. Also, when you go to your barber or hair salon, the question is, many had thought that whether or not you should wear a mask, and since you don't know the situation of people in the barbershop or the hair salon.
Dr. Callender, I have a question about how viruses work indoors as opposed to outdoors. I think it seems obvious that when you're outdoors, the space, affects the fact that the viruses are farther apart. But when you're indoors and less ventilation, the viruses are close together.
Yeah, it's certainly, it's clear that indoor is the bigger problem. And That's the challenge. And of course, when you're talking about going to a movie theater, everybody's eating stuff, and so they can't wear the mask all the time anyway. And so it's different from when you go to a concert or something, because you can wear your mask, whereas you go to the movie theater, most people are going to be drinking sodas and eating popcorn and that kind of thing. So it makes you wonder. But you can see both sides should be wearing masks, unvaccinated and vaccinated.
So in a movie theater, you're in that theater for hours with people who may not be vaccinated. That's very scary to me still, even though I'm protected. You know, I've got both shots and fully vaccinated and all that, but
You're right, right.
Indoors with somebody you don't know who may or may not have it, protection.
You know, Dr. Callender, the Carter Barron is where my brother had his graduation. And so that would be a good place because it's very spread out.
Yeah, the outdoor places are much better. Riding public transport, they have that as a mask. But you can't get on public transport anyway without a mask in DC. How about in Chicago? Do they require that now?
Don't know. Haven't. Whoops. Yeah, don't know. Haven't been on public transport in Chicago for a long time.
I rode the metro down to the Nats game a couple weeks ago, and it was okay. You know, my son.
Masks are required though.
Oh yeah. Oh, definitely. We had a mask on the whole time, but it wasn't real crowded, and people acted well.
Did they have a limit on how many people get on per car?
Actually, no.
Okay.
But people just naturally spread out. You know, you weren't close to other people just naturally, but it wasn't real crowded.
Okay.
That's one of the things that has occurred is people have avoided public transportation, and therefore it's become safer because there aren't crowds.
The Washington Capitals, they just had their first home game last night with fans in the stands, 2,000. I think the place holds 16,000 or something like that inside.
Yeah.
2,100 people there. That's the first time they had fans since March of last year.
Now, how do you sing in an indoor chorus with a mask on? That's interesting. Carol, what you know anything about that?
No, but you can ask Bonnie. She's a singer, professional singer.
Bonnie, how do you sing with a mask?
Well, you just sing with the mask on. You know, I wear a double mask now, but if I'm singing, I just sing with, and I'm going to use a mask, I will use the single mask and just sing with the mask on. Hey, what can you do?
Sounds like a good song.
Do you try to project more? Do you project your voice?
Indeed, you have to over enunciate, pronunciate, and all of the other CHs.
You have to project.
You do have to project more.
Right.
Mm-hmm.
Otherwise, it'd be hard to understand.
Effectively.
Okay. Eating indoor restaurants and bars are an area that also is challenging because you're indoors and everybody has to take off the mask to eat. So So it's risky. Outdoors is not as risky as you can see. All right, this is food for thought for everyone as you go about your deeds. And but anyway, at least now it becomes clearer to everyone what you should and should not be doing in different circumstances.
Yeah, I sent this graphic out to everybody separate, so you can print it out.
There you go, huh? Yeah. So this is a good news for many, because if they're vaccinated, they can go outside without a mask. And and I think they keep saying that you can safely dine outdoors with friends. But you see this paragraph here for indoors, that's another story. Yeah. And they keep saying it again and again, so that to emphasize the point that you should get vaccinated. That's the bottom line. Implied statement is that you should get vaccinated. And we still have a number of situations in which people are not getting vaccinated, and they are continuing to refuse. I don't know whether the percentage of Republicans has increased or not since a lot of this discussion is going about. But I knew the more recent studies demonstrated that the Republicans were in the larger group of people who were not getting vaccinated.
Dr. Callender, I have a question. I didn't really know how this COVID thing turned into politics. I mean, whether you're black, white, Republican, Democrat, the statistics are the same for everybody, aren't they?
No.
Why should it be Republican and Democrat?
Well, I can't answer. Some would argue that it's because of Trump, but I don't know what the reason is. But I know that they demonstrated, the data reflect that 60% of the Democrats were vaccinated and 40% of the Republicans were. That's a matter of record. Now, the why is the question. Some people argue that's because of the president. I don't know the answer, but I do know that it is a fact that it is a political issue.
Yeah, but I'm thinking, why would they even do that study?
What's that?
My question is, why would they even do a study like that? That would mean now they've got to get the percentages of how many blacks, how many whites, how many women, how many men, you know.
Well, they should have it. I think it's important. It's important for our health.
Yeah,
So,
but the least of the importance probably would be the
I'm sorry?
The least of the importance of these studies would probably be whether Republicans or Democrats are more likely to be vaccinated. I think that's on the bottom.
Well, I don't know whether that's true or not, because I think that the idea is to find out who is getting vaccinated, who isn't, and let the data show, and then hey, deal with it as the data reflects.
You know,
The COVID task force is interested in making sure as many Americans as possible get the vaccine. So they need to determine what are the hesitant communities, and so that they can try to overcome disinformation. You know, wherever the area is, whether it's a minority, whether it's political affiliation, but there's something that they can do about it if they know where the problems are for vaccine hesitancy.
and Dr. Callender, I also think that political philosophy does have something to do with it, because Republicans tend to reject government control over individual rights.
Exactly. Yeah.
That's what I believe. So anytime the government says you have to do something, Republicans are going to say, we don't want to do it. And this is a generality, okay? The Democrats would be more likely to go along with it. But, you know, the political philosophy does have something to do with it. They, you know, like in Florida and Texas, they say we're going to wipe away the mask mandate. That doesn't mean not to wear a mask. That just means that the government is not going to tell you you have to wear the mask. It's going to leave it up to your sensibility or your intelligence as to whether you want to wear a mask or not.
And Trump's best chance for winning was to run on the economy, and the economy does better once businesses don't shut down. So he wanted as many businesses and state governments open as possible during the last year, and that's just continued. You still have places like Texas, Florida, where they want to open up everything, and so that to promote business because they're still running on the economy.
It's strange, though, to me that Trump wants to take credit for getting the vaccine as fast as it was. And yet the Republicans don't want to take it now that it's a matter of fact. So he wants to get credit for getting it developed in a hurry, but now he's advocating not to take it. It's kind of funny.
Well, are you saying that Trump is advocating not to take the vaccine?
Well, I'm saying that, I guess, because you're talking about Republicans not wanting to take it. It seemed like he would be pushing the Republicans to take it since he was the one that got it developed and wants to take credit for it.
Yeah, you're right. And but he has been vaccinated himself.
Yeah, he did.
You'd think he would have promoted that, but you're right, he didn't, which is strange.
He wanted straggler votes for people that were pro-vaccine, but he also wanted the people to vote for him that were anti-vaccine. So just playing both ends against them.
Kevin, were you trying to say something?
No, I'm just, I was just agreeing with Daryl on that and John in regards to, you know, the political stance on it.
Okay. Now, as we talked last week, we still don't know how long the protection from the COVID vaccine is going to last. And we will have an idea shortly because they've tested the people who were vaccinated 6 months ago. And so they should have some information as to whether or not the antibody levels are still up for those at 6 months. But we still got a ways to go to find out about whether it's going to be longer than 6 months. And so the answer will be delivered shortly in terms of whether neutralizing antibodies are present at 6 months. That's the first question.
I would like to say, remember the Tea Party? There's always this part of human beings that really revolt against being told what to do. And then Trump came in about draining the swamp, shutting down government, not having government telling you what to do before, you know, we even had this vaccine. So people are they're still living by that from the Tea Party and everything. They're like that 2-year-old. You can't tell me, you can't hold my hand, you can't tell me what to do. So we still have that mentality among adults that they don't want a government that is controlling whether they have education and everything else, electricity. They still don't want anyone to tell them what to do.
It's interesting that certain hotspots still remain. And Michigan, of course, is one of them.
But this also falls in line with couple weeks ago, we had the article on the military, and a lot of military do not want to get the vaccine. And some say they've always been told in the military, do this, do that, do that. You're told what to do. With the vaccine, there's a choice, and they don't want to do it. So, strange way of looking at it, but it's true.
Yeah, it is. It is.
Yeah.
Interesting. Yeah. Yeah, I remember Chris making it clear that he did not want to be vaccinated. So.
Yeah. Good or bad, I think he'll change his mind, but for now, no.
Well, seeing what happens with his children, it might be educational. It's interesting to see how a lot of the effort is about businesses, and people have lost their jobs and lost their businesses, and so it's had such an incredibly negative impact upon businesses that and I think that's one of the reasons why some of the governors were concerned, because so much unemployment, so much loss of bankruptcies and so forth and so on. So the economic burden that's been placed upon everyone has been enormous, not to speak of the psychological burdens as well.
Dr. Callender, I have an observation. You know, the smarter you are, the more intelligent you are, the more educated you are, seems like you would understand the importance of the vaccine and the serious nature of the virus. I mean, you know, over 500,000 people have died here, and I forget the number in the world, but it's millions have died.
2 million.
Worldwide. I mean, you know, to me, it's totally obvious what has to be done, but the more you study about it, the science behind it, you will go along with it. So I'm afraid to say that it seems like some people are preying on the ignorance of people who don't know science, who don't understand medicine, who don't understand, you know, how this stuff works, and they're afraid of it. So they, you know, the pundits or the detractors prey on that.
The more surprising group that is not ignorant is the healthcare providers, and I'm always surprised at the fact that in the hospitals that you have healthcare providers. One hospital, 55% took the vaccine, and one hospital, 70% took the vaccine. You would think ordinarily that the hospitals would be 90 to 100%, but that's not the case. So it has to do. I'm not sure everything. What are all the factors that made those people decide yay or nay? But it's very interesting to really analyze and study the healthcare providers and find out why so many of them were reluctant to take the vaccine.
I disagree with John Buchanan. If intelligence was what counted, there are a lot of intelligent people per se. And as Dr. Callender said, there's physicians, there's people that do things and they know that they will be killed by it. There's physicians that smoke or are obese. They know the downfalls and the pitfalls of it. There are people that are not that intelligent and know the pitfalls. It's whether or not you choose to do that. I don't think there's been intelligent people that have fallen into cults. So I don't think intelligence has anything to do with it. You have to go into the line of psychology to see why people react and do what they do. They all have different reasons, but I don't think intelligence has anything to do with it.
Smart and wise are mutually exclusive.
Well, common sense is not common. Even though we call it common sense, it's not common. It's uncommon. And it reminds me that Carol asked a while ago, and I have not forgotten that the question about why all these cults and why so many people join cults. And so I'm in the process of getting somebody to come to talk to us about that. But the psychology of it is perplexing to understand why so-called intelligent people, so-called people who should know better, act differently than they should. And why do they do that? Why do people, in spite of being many degrees and being so-called intelligent, still do things that aren't wise?
If you have a panel on that, I would love to sit on that.
Well, we're going to have somebody talk about that to our group shortly.
Yeah.
Have somebody in mind, just trying to get her permission to join us and talk about that, because that's something that is remarkable, that cults are still with us and people still do things when they know better, but they still do them. So why? And that's the question that you're asking. We'll get some answers and thoughts on that when we get somebody to talk to us.
I think it started with Adam.
Now, Eve.
Oh no, don't say that, please.
Oh, no, you didn't.
That's where it started.
Look out,
the Garden of
look
Eden.
out.
Can we say the Garden of Eden? Can we just leave it right there? The Garden of
Okay,
Eden.
all right. Yes, it started with God.
Being defiant and disobedient.
It takes two to tango.
Amen, sister.
All right.
Yes, no comment. It does take two to tango. 1 billion global COVID vaccine delivered. Well, it's interesting that they said this in a very positive way, but they said that at the pace we're going, it still would take 19 months before 75% of the world is vaccinated. And then they point out what's important is that this fight is tilted toward the rich countries, and that and India we'll talk about later as top 300,000 for a week, and a day for a week, and it's frightening to see how we have not shared across the world. And but that is not a new thing. That's something that the rich get richer and the poor get poorer, and so we've got to work on that. India, Argentina, and other places in despair, and leads right into the next article about India's COVID tsunami. And can you imagine 300,000 cases in 24 hours? Wow. And what's even worse is that the hospitals and the are full, and they're running out of oxygen. They're running out of everything.
And the death rate is so high that their crematoriums are melting down.
Right. Isn't that something? That's horrifying. But the real frightening aspect of this point here is that there are people who are dying that nobody even knows about it. So that the figures, although astronomical, are not reflective of what's really going on in the country, because it's probably much worse than that. We're seeing just the tip of the iceberg.
So with
Dr. Callender, there's a photo that I did not include because it was so upsetting. Instead of crematoriums, they were just lighting fires in the middle of the town and just piling bodies up and burning them. in India.
Wow.
Very
Well,
interesting.
what is amazing is often our inhumanity to other humans and our lack of caring for all mankind, regardless of ethnicity.
You know, unless we get places like India, Brazil, Argentina under control, they could introduce some variants that create worldwide surges and push back return to normalcy by many years.
Absolutely. Absolutely. So that's why we have to look out for all people, not just us, but all people, because in the final analysis, it affects all of us anyway. If we didn't know any better, we should learn that from what's happening in the United States. And we're seeing more articles, and I'm happy because it's important for us to become more aware of what's going on around the world. It's not just us. It's a pandemic, which means it's the world. And this is what you were talking about, John. The piece you didn't want to show. Chaplain isn't here, but she, of course, would comment on the fact this is her country. So. I see. It's good to hear Germany is working on something, as should all countries, all industrialized and wealthy countries.
Dr. Callender, I think that the billionaires, I guess I would call them trillionaires, in our country, they have enough money to help that situation in India.
Well, they are, and they have been. Gates has been working with that situation for quite a while. Yeah, and I think they have a responsibility, as does the governments of the world as well. Can you imagine running out of oxygen?
Dr. Callender, how closely do we monitor our vaccine supplies? This week on the news, I can't remember what state it was, they were, the expiration date when the vaccines were about to expire. They were encouraging people to get your vaccines, but I think we might in some areas be at a lull. They're not rushing to get it. So I don't remember what state it was, but I often wonder, did it expire? How much is expiring? How closely are we monitoring?
I don't know. That's what the CDC and groups like that are supposed to do. And I think one of the biggest problems is that the vaccines that they had were not used, as you pointed out, because the supply exceeded the demand.
Right.
And so that is an issue that I don't know how bad it has become in some areas, but it's food for thought to see. It's interesting. What is India doing? You know, sometimes people forget that India and China represent more than 50 to 60% of the world's population. And those two countries, we're talking about close to between 3 and 4 billion people. And so what happens to those countries is very important. And this is us sharing AstraZeneca shots with the world. 4 million doses is with Mexico and Canada. Yeah, that's a start. This answers your question. More than 3 million people worldwide have died COVID-19, making you wonder why people would even think about not taking the vaccine. But be that as it may, it's an issue.
Just some numbers, because Africa is very rarely mentioned as far as high population centers. Africa, the continent, has 1.3 billion people, and Asia, which includes India, has 4.6 billion. But of that 4.6 billion, you have 1.1 billion in India and less than a billion now in China. So Africa outweighs India and China currently, but nobody mentions little old Africa.
It's interesting that they were mentioned in communications that I read that talked about the fact that Africa is among the countries that would not be getting the vaccine until 2022, which is scary. Now, I thought this is an article that people don't pay too much attention to, but it's important to recognize that they do have an antibody cocktail that reduces the risk of symptomatic COVID. And this is one of those antibody cocktails that the president got. And this is, of course, as we recognize, this is an expensive thing, but it's something that if you are exposed to somebody who has the virus, this is the kind of thing that can prevent you from getting the virus. It hasn't been publicized as much as it probably should be. So that people who are exposed, they can be treated by this medication and prevented from contracting the virus. But the cost is somewhat prohibitive, and that may be one of the reasons why it's not so publicized. One of the problems is we tend to be more concerned with treating disease when it occurs rather than trying to prevent the disease from recurring in the first place. And this is what that drug would do, would keep the people who've been exposed from getting the disease. And an ounce of prevention is worth a pound of cure. But even in this instance, sometimes that has not been addressed. Now, this is a study that suggests that we have somewhat of a herd immunity effect in the sense that where you have the vaccine used, the incidence of the infections decreases. And so this is something that the statisticians are looking at to see the correlation between the areas that have symptomatic infections and the areas which are vaccinated. And as you can see, they had a drop in symptomatic infections in those areas that were vaccinated. So in some instances, it appears as though you don't even have to have that 70% herd immunity effect in some areas. So it's food for study to to see how the vaccinated areas impact or reduce the number of COVID cases. That's interesting. West Virginia, they pay $100 to get the vaccine. That's interesting. Well, yeah, the reason is because in the younger population, they sometimes think they're invulnerable. They don't think they need to get the vaccine, just like Janice was saying about some of her relatives. And so for the younger people, they were giving them $100 savings bond to bribe them to take the medicine. That's interesting. Recognizing that when you get up to 70%, the herd immunity may kick in.
You know, there's a big problem with that, though. You know, what happened to all the people that volunteered to get the shot originally? How come they don't get $100?
Well, it's easy because they were willing to take it, so that's not an issue. This is to encourage those people who would not ordinarily take the vaccine to take the vaccine, because it's in our own best interest to have as many people vaccinated as possible. So I think it's interesting to see an approach that recognizes that the so-called invulnerable young people need additional incentive to take it, whereas the older people who recognize that lives are in jeopardy took it because they wanted to live.
Hey,
The
Dr.
younger people
Callender,
don't realize that. Yes, Sylvia.
West Virginia might be on to something. Suppose there was a lottery or something where any state who reaches at least 75 to 80% of their population who has taken the vaccine can actually get some government funding for something. You know, they may be on to something. $100 to anybody who takes it. What if that challenge was put out to many of the states? They say, hey, whichever state gets the most people vaccinated by blah, 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 could get funding of whatever. But, you know, it might be a concept that might be worth investigating.
So true. I think anything is worth investigating in order to get get as many people vaccinated as possible. So we should be creative and recognize that whatever works is what we should be doing, because we have a crisis that we need to do something about. That's all of the articles, John?
Yeah, I could pull up some other ones, but yeah, that's all I have right now.
Okay. Any comments or questions about any of them?
I don't know whether this is definitely a question about the articles, but I remember hearing that people don't necessarily have to get their second shot where they got their first shot. So I often wondered whether when they go wherever they go to get their second shot, do they communicate that they have had the first shot? And do they have to take their card, or is it recorded just like people who go to the same place to get both shots?
Well, when you get your first shot, they're supposed to give you a card that identifies that you've had your first shot.
Yeah.
And that also gives you an idea when you should get your second shot. But many studies are demonstrating that a number of people who've gotten the first shot have not gotten the second shot. And the data indicates that the first shot gives you 50% protection, and the second shot gives you 95% protection. And so I don't know that there's any law that requires you to get the second shot, but common sense suggests that you should get the second shot. And the question is, should we go further along the lines and make it, you can't make it mandatory, but make it strongly suggested and highly recommended that you take the second shot.
Yeah. Yeah, I was just wondering whether those people who don't go back to the same place to get their second shot, whether or not they show that card when they go somewhere else, or whether they just go in and get a shot and have, you know, because I even heard on the news that you can just go in and get another first shot. I mean, psychologically it's the second shot, but are they showing that card when they go somewhere else? That's, I guess, what I'm asking.
And I don't know the answer to that question.
Yeah.
They should, but whether they do or not, I'm not sure that that's been monitored.
Yeah, because some of them may have had 2 shots and just got them in different places and didn't show.
Dr. Campbell,
Yes.
to kind of follow up to her question, is there a master database? Whereas you get your first shot, you lost your card, but you think you went back to the place where you received the first shot. Is it in a database? We can just give your name and they call it up?
In the there's a database in the states, in the District of Columbia, in the different states, they should have a database. I don't know that it's been tested, but I know in DC they do have it on the computer. I can't speak for every state. Every state has a different way of doing it.
In Maryland, where we got our shots, we were in a database, so I don't know.
Mm-hmm. I pulled up some extra charts I can show real quick.
I have a question while he's pulling up the charts. What would be the sense of someone getting 2 first shots?
His first shots are just like
yeah,
his first and second shot.
Yeah, they said
that's the same thing.
Shot. Yeah,
it's the same thing.
Okay.
Is there any information, Dr. Callender, on or coming out a little bit more in regards to counterfeit cards being pushed?
Yeah, that it's amazing how people will come with counterfeit anything, but they come with counterfeit cards, which is bothersome and it's problematic. I don't know what to do about that.
Kevin, are they selling them?
Yeah, they're selling them. They had an article in AARP about the fraud that's going along with the COVID, with the coronavirus pandemic, because now they're selling information, and people, they're trying to trick you into giving them your social security information and all that. And they're preying on old people, of course, older people who might be afraid, you know.
Well, this article you have here is kind of not helping in the sense that 226 million vaccine doses administered, but that does not mean that 228 million people have been effectively vaccinated, because if you divide by 2 for the Moderna and the Pfizer, you'd realize that we're still in the vicinity between 100 and 200 million people who've been effectively vaccinated. And so we're still far away from the about 300 million, which we need to reach the herd immunity level, because most of the first vaccinations involve Moderna and Pfizer, which require 2 shots. So the fact that you administered 228 COVID vaccine doses is not help answer the question.
Doc, this chart is about the cases.
I understand, but that's not. But the bottom says 228 million COVID vaccine doses administered in the United States. I'm referring to that. So if one would recognize that most of the people who've been vaccinated require 2 shots, you realize that we're talking about probably somewhere between 150 million people have been vaccinated, not over 200 million. Okay. Now the top of it looks at the deaths, and 572,000 deaths, 32 million cases, right? And it does say 208 vaccines administered, but that doesn't. And then it says 28.5% fully vaccinated, and 30% of 300 million people comes out to a figure I can't even figure out. Probably 30 times 20, probably.
Roughly one.
Actually, that's close to 1 million. 100 million. Yeah, close to 100 million. Although the number has been reported to have been in excess of 100 million, which is what Biden had promised to deliver in his first 100 days. So he has actually delivered on his promise. Any other questions or comments about anything? How many of you are afraid, even though you've got your vaccination, that you can get COVID?
I am. And the reason is because of my immunosuppression.
And the studies have not yet, for example, the initial study that identified that transplant patients who were given a vaccine after the first dose did not have adequate levels of immunoprotection. But that study did not test transplant patients after the second dose, which is after the booster shot. And so we don't know the answer to that question. And so for those patients who are immunosuppressed, those patients who are on dialysis, we don't yet know how protective the vaccine is for them, because that group was never studied before.
Yeah, but Dr. Callender, I would think that after the first dose, they did the studies and they found out that was some deficit in the antibodies. So if they get the second dose, I think that there probably would be still some deficit in the
Well,
antibodies.
we don't know. So we'll know shortly, because we will
I'm just
be able
basing
to get an answer. So
basing it off the first shot.
Guessing won't do it. I think we need to test and find out what because the booster shot theoretically might help, maybe not, and then we just need to do the testing and find out.
Well,
and it can be done.
Someone that's not immunosuppressed, if the first shot is worth 50% and the second shot is worth 95% efficacy, then those numbers would correlate to somebody that's immunosuppressed.
We don't know whether or not that is true. So we need to do the studies and find out, and that's doable. So I think we'll have the answer in another month or two, because the second dose was administered 3 weeks after the first dose. So I think within another month or so we could get an answer to that question and find out. But I think your concern is a legitimate one, and we'll have to wait and get the answer to the question.
Dr.
So that's why,
Callender,
go ahead, Rochelle.
yes, I'm a breast cancer survivor and been through chemo and radiation and stuff. I've taken both shots, but nobody's talked about people who has had those type of medicines put in their body.
That's a good point, and that remains to be seen as well, because those special groups that have received chemotherapy and immunosuppression, as John Tatum was talking about, are groups that require special attention and have to be looked at and studied separately, because we do not know the answer to the question without actually doing antibody tests after those groups have received the vaccine, because those groups were not included in the original studies.
Yeah, well, I would be willing to take a third shot.
Well, I think you will get the answer. And it may well be that those groups will need a booster shot sooner than other people, because they may not have the same high level of antibody titer that other people do. So that's a very important question that needs to be answered, so we know how to advise people in the future.
Sylvia,
Yeah,
go ahead.
Dr. Callender, what do you think about those at-home kits where you can test yourself to see if you have COVID and get your results? I think within the
Yeah,
same
okay.
day.
I think if you, yeah, I think they cost a little bit, but they're worth it if you want to. Yeah, I think they're approved, FDA approved, and so they're worthy of using if you are concerned about whether you're COVID positive or not.
Dr. Callender, I would like to, hopefully next week I can maybe give you some results. I have a grandson that's 17 and he had his last shot yesterday, and he also has Crohn's disease. So he doesn't talk a lot, but I'm going to try to get him to tell me how he feels today and just how it may be affecting him. Kind of curious of the young people and how the shot may affect them.
Yeah, because there's a lot of controversy, but not a whole lot of data. They are the group that's more recent, eligible to get vaccinated. One thing about them, though, is that they at least have been studied. The groups that Rochelle and John Tatum talked about were never studied. The group 16 and over have been studied, but these immunosuppressed and people who've been treated by chemotherapy and radiation have never been studied at any time. So this is a brand new territory for them.
They had so many groups to study when we first started this pandemic. You were saying it would take 1.5 years before we would even have a vaccine, and we had one within a year. So they have so many different groups to study to see the effect of this vaccine. It's going to be a while for them to catch up. First, they found the cure, or the vaccine. Now they got to study all these different individual groups to see exactly what's happening. Just 2 announcements. Maya did text me and said that she had a doctor's appointment today at 9 o'clock, and that's why she wouldn't be in on today. And I see we have a new guest. I think Charles is also on. And I think, is that right, Sylvia?
Yeah. I want to thank everybody for their prayers. Charles had to go back into the hospital. He had scar tissue in his intestines. So that's where he is right now in Georgetown. I text him, so he has a tube down his throat, so I'm not sure he wants to talk. But he's been there since Sunday, and so we're just praying. He is setting up, and he says, I'm trying to walk as best I can just to be sure I get exercise. So he's listening. So thank everybody again. Keep praying and for this healing. And I thank you all.
Thank you. Welcome, Charles, and we are praying for your complete recovery.
Hi, Charles, praying for you.
Yeah.
We're praying all the time.
Definitely.
Okay.
One other question, Dr. Callender. As far as people who have pre-existing situations, have studies been done on whether these vaccinations cause them to rise to the surface more?
No, studies have not been done on that.
My niece with Down syndrome, since she's received both of her shots and has become fully vaccinated, we are monitoring her quite a bit. She just went to the doctor last week for a checkup, and we don't see any symptoms or signs of any negative feedback from the vaccination. So we're really thankful for that.
Yeah, Dr. Callender, I was in Georgetown Hospital a couple of times for some situations that I had. And I had both of my shots before both of those hospitalizations. Now, when I came out the hospital after the second hospitalization, and I'm 73 years old, I came down with diabetes. And so I'm wondering if, I've had diabetes 2 times before, once right after the liver transplant for 9 months, and then once after the kidney transplant for 6 months. And in those cases, they went away. And the doctors told me that it probably had something to do with the steroids. And so now here's the third time coming down with diabetes. So I'm wondering, and I will always wonder, what was the cause of the onset this time around, whether it is still steroid related, whether it is because of the vaccinations or because of my age or immunosuppressant. Those are things that I'm wondering about.
Don't have any answers for you. Sorry. Well, I think we've covered it for today. Any other? Oh, I was wondering, Daryl has committed himself to putting us on YouTube, and actually we developed quite an archive of copies of what we have. And you think there's any merit in us keeping all those together as part of our archives?
Yes.
Because it's an interesting resource that we may be taking for granted, that may be very important to our past and to our future.
It's historical.
What do you think, Daryl?
Good question. I don't know. Let me give it more thought.
Okay. All right. Food for thought. Okay, I think that covers it for today. And
just one other thing. There's some people that are new. They might not know what you're talking about. So maybe if Daryl can explain it, and then we can tell other people how they can also listen to the session that we're listening to about Daryl, how you broadcast it on YouTube, on podcast.
Okay, I've got a YouTube channel that's called Black Health Matters. And generally every week I post the group session video to that channel. Also, John Buchanan sends out an email that says this is a link to last week's session on YouTube. And Usually I just describe it as this is a Howard University Hospital group session hosted by Dr. Clive Callender. But for the guests that we've had on, I describe the guests and their topics. I forget some of the past guests that we've had, but some of the topics have been vaccine distribution in the DC area. We've had the transplant surgeon on that was talking about her experiences as a Black physician. So some of those by the description, you can say, well, this is an interesting article that I want to read. Others, there's just a general description that we talk about our medical articles during the group session, and probably most of those are about COVID-19, most but not all. So, the particular sections where we have a guest speaker on, I can see the value of archiving that. Where we just talk about the general medical topics, maybe not so much. I do have some subscribers to the channel that watch it every week, so they're not on the group session, but it's been sent out on some podcast distribution channels, like there's Apple Podcasts. There's about like 20 different podcast channels it goes out to. So it's not just a YouTube channel, but those are people that are going to be consumers of the recent session. And possibly they might go back to the description to look at some of those specialized sessions.
And one other thing, he does edit in case we say something politically that's not correct and shouldn't go out to the masses, because sometimes I say things that shouldn't go out anywhere.
Well, sometimes the merit of the group discussions are interesting enough of historical notes. So anyway, I just put it out for food for thought because I think it's just a special group, and some of the things that we take for granted may not be.
The other thing
should not be taken for granted.
The other thing, sometimes some of our participants have to miss for some reason or another, like Maya's missing today. Betty Blaylock had to miss one time. And so our participants can always go to Daryl's channel and view what they miss. And that's a good thing as well.
Yeah, I really felt bad about Maya missing today with all the focus on India. She could have really given us her own personal insight to that.
Yeah.
My prayers have been with her. I've just been praying so much about that, because I just think it's such I can't even imagine if I have family, and I mean, I can just feel it. Even my doctor is from India, and I talked with him. His mother is still there, and we just got to be very prayerful right now.
Yes, we really have to care and show our love that God gave us for each other.
I will say this is that, we normally have about 16 people on each group session on the average. And that's a powerful base of influencers. If we talk about getting more of our community aware of transplant, donorship, and different medical issues, the way that you have a base of influencers operate in today's world is that they have to share on social media. And so it's a very wise thing for us to do. Okay, the YouTube, the sessions are posted on YouTube. You get the links, share that link on all your social media. If it's Facebook, if it's YouTube, if it's Twitter. But the base of 16 people all sharing can have a powerful influence on a community, and particularly for our primary influencers, which are our ministers and our beauty salons.
And barbershops.
Sylvia, your hand is up.
Yeah, I like to address the archiving, and I think it's good when you have special guests. Like I forwarded the link to my daughter, my son, regarding the transplant transplant female doctor, so they can, see and hear what someone has gone through that, they may be able to draw strength from. And so I was just wondering, when you have the podcast, nobody can see the articles. Is that correct, Daryl?
That's correct. The podcasts are audio only.
Mm-hmm. So if we were to, archive the podcast, I think we just need to be sure we have a little bit more detail when we, announce the topic, say, give a more detail as to what the article is about, so that someone who's listening for the first time, then they can say, oh, I can take the whole article in its context. And so, we're seeing the articles on the screen if we're doing Zoom, but for someone who's not doing Zoom, can they get a good flavor for the full contents of the article and during the podcast discussion, that they know exactly where we're discussing?
Yeah, excellent point. Silence is the enemy of podcasts. That's when people drop off. And so with that in mind, knowing that we do have a podcast audience, it's important for us to keep talking while the slides are up, and at least give the gist of what the slide is. We could do that and make an effective podcast with people not being able to visually see the articles.
Yes.
Good point. Good point. Okay.
We have,
We
have an app meeting Monday at 1:00.
Right. Betty, you had something to say?
Yes, I would like to thank Mr. Buchanan. I'm not on the podcast and the YouTube, and I'm not that tech savvy, but he sends the article directly to my email, and I appreciate that. So I can easily share it with others.